It's a great honor having the opportunity of speaking to you today. My job is to talk about what's next in medical imaging, and I'll cover 3 or 4 areas. First, we'll take some clips from our recent film, our discovery film, Surfing the Healthcare Tsunami, Bring Your Best Board, where we address the 5 rights of imaging, which is a reconciling framework that both caregivers and consumers can use. Second, we'll cover some soon-to-be published articles that address the 5 rights in health information technology. Third, we'll cover some topics, these same topics reviewed by a national audience and at a national summit to evaluate whether they're helpful in the future of imaging and focusing on quality and safety. And finally, we'll address culture and the 4 T's of leadership: truth, trust, teamwork, and training. The 5 Rights of Imaging program is a free framework developed for the public with global experts that helps make sure that the right study with the right order performed the right way, generating the right report drives the right action for every single patient every day. It embodies the priorities of radiology organizations focused on radiation safety. So as we talk about the 5 rights of imaging, what do consumers need to know?
It's wonderful to have the right study. We often don't pick the right test, and duplication of tests are enormous in terms of expense. Given how much information a physician has to work with, it's actually not surprising that we miss orders so often. They really need the ability to have a checklist to be able to look and figure out what is the best test right now for this patient in this circumstance. Patients and consumers know a lot more about what's entailed now, particularly with the low-dose technology, and they're asking for it more, and I think it's important that we begin to actually are responsive to their needs. Getting the clinician the information that he or she needs when the time is most appropriate, when they're seeing that patient, that makes a huge, huge difference. The actions that we take after a test are critical, and often we fail to connect all the dots. The good provision of services, the good delivery of medical care should be well informed, and having all the information that you need to make the right action with the appropriate amount of information is essential.
So that when the patient returns to the doctor and reviews the results of the imaging studies, hopefully it will inform which direction are we going. Is this a disease that needs aggressive intervention? Is it a disease that can be watched? And hopefully the imaging test helps to answer that question.
An article, a free checklist, and smartphone application provide a guide to consumers and caregivers of the 5 rights.
It's extremely important. I think we know the variation in the use of imaging technology is still tremendous. And to have approaches that use evidence-based information to select the proper test and perform it the proper way would provide enormous dividends. And again, provide the right care at the right place at the right price.
There will never be a more exciting time in healthcare than today. That is, get on board, help change the world. We can save money and improve quality at the same time, and use those savings to help pay for infrastructure that we need so badly in healthcare. And that's really our job. And I think to energize people is to say, this is the unique time. This is a unique time, and it's not going to happen 3 months from now, 6 months from now, 9 months from now. It starts today. So get on board. It's going to be fun.
It's absolutely critical that we focus on all of the issues around each of the 5 rights and not just focus on the dose that's delivered and the ionizing radiation that's delivered with particular study, but actually expand entirely around this route. As a radiation oncologist who was one of the leading referrers of high-tech studies, I understand how critical it is to make sure to identify what study needs to be ordered and make sure it's properly ordered so we get the results and don't need duplicative studies. The organizations on this slide all participated in the development of the 5 rights and dissemination of this focus, and a number of articles. Dr. Don Frush and others have been very actively involved in a special issue of the Journal of Patient Safety, of which I am the editor-in-chief, to present a number of the issues and a number of the areas of critical importance. This slide really addresses not only the 5 rights of imaging, but then applying that to children. it turns out that everything we do for children has direct applicability to adults. And what we're learning about children in the United States, 10% of all imaging studies are on children, and 90% of those, we call it our 90-10 rule, 90% of those are done at non-child focused facilities. This is really important in that it's very hard to maintain the proper protocols and make sure that we're right sizing the dose and the protocols for studies like CT scans of children. Absolutely vital, and we're learning that initiatives like Image Gently are absolutely vital, but it's so important to make sure that we have compliance with those. The slide that has the 5 rights of imaging with the red pie slices represent the areas of risk. And those are areas of risk of overuse, underuse, and misuse of ionizing radiation and the studies that use it. In terms of the sector between the right study and the right order, there's significant risk as to whether we should even order a study at all. And then what is important is that ordering the proper study, the proper sequence of studies, and make sure that prior baseline studies are available for the radiologist. If not, we may not get the information we need or the vital information that could be obtained by delivering ionizing radiation. The slice that overlays the area of the right way addresses dose limiting and right sizing of protocols, as well as the technologies, the scanners that deliver the least amount of ionizing radiation, or even using ultrasound instead of studies that might use ionizing radiation. And then the other 2 red pie slices really address 2 other areas of risk. Clearly, we all are familiar with getting critical studies and making sure that the critical results of a study are important, and that is very obvious. But what was really frightening, and actually something that really was a wake-up call for us, was that working with malpractice firms, we found that there is significant risk, malpractice risk and harm that happens even downstream after a study might be ordered properly, might be undertaken. You might have the right study, the right order, the right way, the right report. And yet, if that actions are not properly taken, primary care physicians, at least in the United States, have significant liability in terms of the actions that are taken afterwards based on those studies. And then for children, the long-term issues. We've used the 5 rights for cultural transformation. We've been testing this with governance leadership boards that have no training in radiology, in fact, no medical training, many of them. And in the United States and abroad, we found that people can really understand the 5 rights, and we always say to the boards, the governance leaders and administrative leaders, you don't need to know all the answers. You just need to know the right questions. And I think that's absolutely critical as we talk about the cultural transformation that is to occur. Now, in the United States, we're doing everything we possibly can to reduce overuse, underuse, and misuse of imaging. Imaging will move in the United States from being a profit center for organizations to a cost center. And that gives us a great opportunity. One of our great global CEOs, Bill George of Medtronic of former years, has said, never waste a good crisis. And I think the crisis of harm and waste is really a terrific opportunity for us to really look at the issue of consultative radiology. We now have pioneering organizations like the Cleveland Clinic and the Brigham and Women's Hospital who are pioneering the concept of taking a radiologist off of reading studies and really transforming the culture of performance improvement and starting to advise the doctors that are ordering the studies upstream. And so the blue arrow represents moving upstream and advising them. So they're actually advising the doctors that are ordering the studies, many being primary care and internal medicine doctors, and then moving downstream and advising them as to how the studies could be optimized and the actions could be optimized to follow. So this has really given us a great opportunity to have a transformational sort of impact on what we're doing. The areas of major focus of our research are taking the 5 rights of imaging and applying overuse, underuse, and misuse to the adoption framework of awareness, accountability, ability, and action. That is an innovation framework we developed over the last 20 years, and then being able to look at leadership, practices, and technology. So this slide actually addresses the intersection of leadership. We need engaged leaders, we need the best practices, and we need the technology technologies that can enable those leaders to implement and assure that those best practices are undertaken. I won't read the slide for you, but I will tell you that the organizations where we've seen the radiation accidents and we've seen overdoses of radiation, we have seen this kind of panel, and what is in red is the absence of really successful improvement and quality. And in those organizations, you can see leadership has been a major failure. Adoption of practices has been poor and failed, and the technologies have not been utilized to reduce those dosages. What's really been interesting, however, is that as we've looked at some of our really good organizations and they've looked at them themselves, many organizations that are very good have had what we call migration of boundaries and normalization of deviance. That's where the protocols might be in place, but they're not being used. We're aware of the gaps, but we're not closing the gaps. Our leaders are not vigilant at making sure that we're doing the right things. And so this pattern is the pattern that we've seen in some organizations that are very surprised by how well they're doing. And then finally, some organizations, and I won't name the first two, but this organization, I'm pleased to say, is the Mayo Clinic in Rochester. The vigilance that they have had in focusing on making sure that they're using the right protocols for the right patients and right sizing them and the right technologies to minimize dose has been very successful for them. In our article, The 5 Rights of Imaging, Patient-Centered Performance, our co-authors are from the Mayo Clinic, the Cleveland Clinic, from the Brigham and Women's Hospital, and the World Health Organization. And what we do is address the performance gaps that exist in each of these rights: the right study, the right order, the right way, the right report, and the right action. And this is a thorough literature review on the issues of these performance gaps and the opportunity to improve. At a recent summit that was held by the American Board of Radiology Foundation, leaders from the supplier, provider, and purchaser community were assembled. We took the 5 rights of imaging and presented it, and presented the performance gaps that exist and the opportunities for improvement. And we used a multi-polling device to evaluate whether it was helpful. 98% agreed or strongly agreed that the 5 rights of imaging framework would help physicians ordering imaging and help patients. 84% agreed or were strongly in agreement that consultative radiology would be of value. 77% felt that role model stories would help communicate imaging safety issues. And 62% felt the framework would be useful for performance improvement of imaging. Now, the Leadership Practices and Technologies framework was also presented, and 61% agreed or strongly agreed that this framework would be good to identify performance gaps and opportunities. We identified 2 enormous opportunities in imaging that we can really work on when we go forward. In our article, A Consumer's Checklist, Is My CT Scan Safe?, we apply the 5 rights and put it in a simple checklist with a version that the primary care physician can use and a version that the consumer or patient, family advocate, or family member can use. And what the checklist does, it allows us to identify the right study, identify the really important issues about ordering the study. The right way is the 3rd right, and we address protocols and whether we're getting it done at the proper place with dose reducing methodologies and equipment. And then we address the right report and make sure that it's getting to the right people for the 5th right, which is the right action. In our article, Safe Use of Electronic Records and Health Information Technologies, Trust but Verify, we address the key issues in patient safety and health information technology. This is really important as we look at imaging because it truly is a health information technology, and we address the issues of the socio-technical model, which is really very important and has been promulgated, developed, and disseminated by the Institute of Medicine in its report on health information technologies. It would really serve us in the future to study this report and see how it can apply to how we can improve in patient safety and imaging as we go forward, because the person-machine interface and the socio-technical model is an appropriate way to look at how we can improve patient safety along all of the 5 rights. In a national webinar that we run every month, it's the world's largest patient safety and quality webinar, we studied the hazards in leadership, practices, and technologies that are keeping our safety and quality officers up at night. And when we looked at the 10 issues that are technology issues that were developed by ECRI, we asked our audience to rate them, and we asked them to use the Net Promoter Score methodology of saying if they gave an item a 10, that was a very high concern as a hazard, and a 1 was the least important in concern. And we found that patient data mismatches in EHRs and IT systems scored a 74 Net Promoter Score, which means when you subtract the 1s through 6s from the 9s and 10s, that you determine what percentage are real promoters of that being a very serious hazard. It's almost an unheard of score, but for our radiology services, what was really important was the fact that that inattention to the needs of pediatric patients when using adult technologies ranked 3rd in the most important area, got a Net Promoter Score of 52%, and 45% of our audience, which was a pretty substantial audience, gave it a 10 out of 10. 21% gave it a 9 out of 10, which is also almost an unheard of score. As we looked at unnecessary exposures and radiation burns, a Net Promoter Score of 30 with a score of 10, and 5% with a score of 9 with a Net Promoter Score of 8, still ranked in the top 10. What this tells us is that our quality and safety officers in this audience that are not radiology specialists or experts or from radiology departments see this as a very serious area and of critical importance. The good news is they're starting to recognize it. The bad news is it really is an issue, and the opportunity is that this is an area of performance improvement in the future that we can really address. And finally, we'll address culture and the 4 T's of leadership: truth, trust, teamwork, and training. In the United States, there's nothing more powerful that got our attention on radiation issues than stories about patients that had excessive doses of radiation through CT scanning, and this really caused a huge impact. Now, we can also use stories to change our culture or impact our culture. And in our recent movie, our Discovery Channel movie, we addressed the 4 T's of leadership that can be used to change and improve performance improvement and culture. And they are truth. Those are the facts, figures, and knowledge that we can deliver to someone. That engages the head. Trust, that is the currency of the heart, and when we use stories and tell stories about hope, dread, fear, and we tell patient stories, it actually grips the emotions, and people can remember the really important issues regarding a subject matter area. And then the 3rd T of leadership that we addressed in this movie was teamwork, how we can engage the hands in the work of improvement. So we engage the head, the heart, and move the hands to action. And then what we found in high reliability organizations like aircraft carriers and aviation and the Blue Angels demonstration team was that they train from within and they use their own voice to teach others.
We can take any sailor marine and teach them how to be a Blue Angel because the system, the process, we take great sailors and make them even better. And we teach them how to work as a team and how to represent the Navy and the Marine Corps. But we can do it for anyone.
There's an infinite number of scenarios that might unfold operationally that you just can't train for. So what we have is an invisible safety net that helps deliver both reliability and safety.
How important is trust?
I always think of the 3 pillars of teamwork being some element of sacrifice, some element of communication, but the biggest element is trust. I go out to my airplane for an air show. I trust that my crew chief and my first air mech have gone over that aircraft with a fine-tooth comb. When they shake my hand and they say, "Boss, this jet's ready to go," I know that they mean it.
So cultural change and maintenance of culture in a high-performance environment, we found in high-performing organizations were that leaders really leveraged truth to engage the head, trust to engage the heart, teamwork to engage the hands, and then training to engage the voice to move to scale. So in conclusion, what can we do next in medical imaging and safety and quality? I think we need to move beyond the walls of the radiology department and, using the 5 rights approach, move upstream and develop consultative radiology means and do some education on the indications for studies, engage patients and families around the whole loop of the 5 rights of imaging, move downstream and look at the impact that the imaging has. The future of accountable healthcare and value-based purchasing is going to have a dramatic impact on the business of healthcare. Profit centers of today will be the cost centers of tomorrow. The way that we could really have a great impact on that 20 to 50% waste that is described in the literature regarding our fragmented healthcare system is how we really undertake reducing overuse, underuse, and misuse of testing. And I think there's a great opportunity in imaging.